This webinar is offered as a courtesy to members of the Illinois Landscape Contractors Association and members of the Illinois professional landscape community. The purpose of this presentation is to provide an overview of the Governor's 5-phase Restore Illinois program, specifically Phase 3, also known as the Recovery Phase. These were guidelines that were issued by the state of Illinois on May 24th, 2020. They are a multi-stage program designed to reopen the state of Illinois for business and economic activity. The recovery phase of the Restore Illinois public health is a public health approach to reopening the Illinois economy. It includes returning people to work, businesses reopening, and allows for group gatherings of 10 or fewer. It recommends that we all continue to social distance and frequently wash our hands and cover our faces to maintain progress in overcoming COVID-19. All of the guidance that is within is drawn from the Department of Commerce and Economic Opportunity from the state of Illinois, as well as the Centers for Disease Control and OSHA. First, a disclaimer. Phase 3 recommends that employees working in a general office setting be trained on the new health and safety requirements of Phase 3. That is the purpose of this PowerPoint. These materials have been prepared by the ILCA in accordance with the materials available on the DCEO website, and they are summarized as a courtesy to members with the guidance available on the date of issue. The ILCA accepts no legal responsibility for anything within these training materials. Further, this guidance may be subject to change, and it is up to each employer to incorporate changes into the guidance over time. Employers may modify this document, but will accept all responsibility for any modifications. The state of Illinois recommends that an employee training program covers the following topics. All of these topics are covered in this training module. First, the Department of Commerce and Economic Opportunity offers an online toolkit. This toolkit will contain business guidelines, industry posters, checklists, a wellness checklist, industry signage, as well as social media graphics. However, not everything that is in the recommended employee training program is available on the Department of Commerce and Economic Opportunity's website. Therefore, additional resources were used, such as the Centers for Disease Control and OSHA, and it is indicated when those resources are used within this PowerPoint presentation. There are 2 industry posters available on the DCEO website, one in a graphic format and the other in text. These are not required, but they may be posted in visible locations. There are 2 checklists, one for an employer and one for employees. Employers should complete the checklist for businesses, while employees should complete the checklist for employee training to make sure that everything that has been provided to you by your employer was covered in regards to training content. There is also an employee wellness screening checklist, and this checklist should be used when determining the wellness of an employee, and it should be done between the employer and the employee. There are 29 different signage templates provided by the DCEO that an employer can use in various locations around the office. There are also 24 different social media graphics that are formatted to either Facebook or Twitter, and these are used to demonstrate your commitment to health and safety. These can be shared internally with your employees or externally with your customers and clients. The sources of exposure to COVID-19. This is according to the Centers for Disease Control. Person-to-person transmission occurs during close, and that means within 6 feet of contact with a person with COVID-19, primarily from respiratory droplets produced when an infected person coughs or sneezes. These droplets, particularly when aerosolized, can be deposited in the mouth, nose, or eyes of nearby people or inhaled into the lungs. Airborne transmission from person to person over long distances is believed to be very unlikely. People can also become infected with SARS-CoV-19 by touching surfaces or objects contaminated with the virus and then touching their mouths, noses, or eyes. Current evidence suggests that novel coronavirus may remain viable for hours to even days on a variety of surface. So therefore, cleaning of visible, dirty, and high-touch surfaces is extremely important, especially in the workplace. This information is taken from OSHA. It identifies the hazard risk exposure for different types of employees. OSHA has divided job tasks into 4 risk exposure levels: very high, high, medium, and lower risk. Most landscape professionals, whether in the field or in an office environment, are going to find themselves in the low risk category, with some of them, especially those who interact often with the general public, will find themselves in the medium risk exposure category. The high risk and very high risk categories are reserved for medical professionals and mortuary professionals who will come in contact with the infected or potentially deceased individuals. The Restore Illinois program, the recovery phase, is broken into 7 sections, and these sections will be explained in more detail in the following slides. First, this information will be applicable to businesses that meet the following criteria according to the state of Illinois. They're for companies that conduct operations from within non-customer facing office spaces. These can be standalone or within a multi-tenant office building. Examples of these types of businesses can be legal services, accounting services, architectural, engineering, design, etc. And these are going to be uniform guidelines across businesses, industries, and nonprofits within the state of Illinois. This guidance does not impact the shop environment, but instead the office environment of landscape contractors and landscape suppliers. First, some general health guidelines. The recovery phase recommends that all employees who can work from home should continue to do so. Employees should wear face coverings over their nose and mouth when they're within 6 feet of others, with a cloth mask being preferred. Exceptions may be made when accommodations are appropriate. However, the IDHR guidance does not cover employees of businesses, but instead customers of businesses who cannot wear face masks. Therefore, it will be up to each business to determine how they will provide necessary accommodations for employees who cannot wear a face mask because of a medically verifiable reason. Social distance of at least 6 feet should be maintained between non-household individuals unless participating in activities permitted under the Phase 3 guidelines. An employer should provide hand washing capabilities or sanitizer to employees and, if applicable, customers. And there should be frequent hand washing encouraged by employees, and an adequate supply of soap and paper towels and disinfectant and hand sanitizer should be made available to them. Now for the second section, HR and travel policies. All employees should complete health and safety training related to COVID-19 when initially returning to work. That is the purpose of this PowerPoint. The resources to design a training program are posted on the DCO Restore Illinois Guidelines website, although this PowerPoint is not. It is a creation of the ILCA. Employers should continue to limit all non-essential business travel. And if an employee must travel, they should follow CDC guidelines, although most of the CDC guidelines that are provided do revolve around airline travel. Employees should not report to work or be allowed to remain at work if they are sick or symptomatic. That means they have a cough, shortness of breath, or difficulty breathing. They could have a fever of 100.4 degrees or above. They would have chills, muscle pain, a headache, or sore throat. They would have new loss of taste or smell, or other CDC-identified symptoms. Sick or symptomatic employees should be encouraged to seek a COVID-19 test at a state or local testing center, healthcare center, or testing location. The list of CDC-identified symptoms does change, so it will be up to an employer to stay on top of what those changes may be. There should be reasonable accommodation for COVID-19 vulnerable employees. This would include, but not limited to, working from home, reduced contact, use of barriers, and other accommodations that reduce chances of exposure. We will get into who some of these employees are and what traits they have later in the presentation. Now for the third section, health monitoring. Employers should make temperature checks available for employees and encourage their use. Employers should post information about the symptoms of COVID-19 in order to allow employees to self-assess whether they have any symptoms and should consider going home. All employers should have a wellness screening program in place, and the sample provided by the Department of Commerce and Economic Opportunity is available on their toolkit or in other places, as well as through the ILCA. The employer should conduct in-person screenings of employees upon entry into the workplace to verify no presence of COVID-19 symptoms. And employers, especially working in a manufacturing environment or a close contact environment, should provide mid-shift screenings to verify the presence of COVID-19 as well. If an employee does contract COVID-19, they should remain isolated at home for a minimum of 10 days after the onset of symptoms, and they can be released after feverless or they are feeling well without fever-reducing medication for at least 72 hours or have had 2 negative COVID-19 tests done 24 hours apart. If an employee is identified as being COVID-19 positive, CDC cleaning and disinfecting should be performed as soon as the confirmation of a positive test is practical. And where appropriate, you should notify other employees who have been exposed so they can monitor symptoms or self-quarantine if necessary. Any employee who has had close contact with a coworker or any other person who is diagnosed with COVID-19 should quarantine for 14 days after the last or most recent contact with the infectious individual and should seek a COVID-19 test where they can find one. All other employees should be on alert for symptoms of fever, cough, or shortness of breath and taking temperatures if symptoms develop. Close contacts are defined as household contacts, intimate contacts, or contacts within 6 feet for 15 minutes or longer if they are not wearing an N95 mask during the period of contact. Now, for the section on the physical workspace. If your office is in a multi-tenant building, the landlord should display signage at building entrances with face covering requirements, social distancing guidelines, and cleaning protocols in multiple languages as needed. They should also display visual markers 6 feet apart at any queue points, for example, elevators, building entrances, or restrooms. They should limit elevator capacity, and they should provide hand sanitizer at building entrances, elevators, and common areas. As an employer, if practical, you should avoid seating employees facing each other. You should encourage employees to remove personal items from their desk. If practical, modify your traffic flow to minimize contact. The use of shared workspaces is discouraged. And to reduce surface contact via no-touch doors and elevators where possible. You should minimize the use of shared work materials. If practical, reduce the use of shared papers and encourage more digital tools. Limit the usage of telephone receivers or limit one receiver to one employee. And where building management practices allow, increase air turnover rates in occupied spaces and increase outside makeup air to the maximum extent that is practical. The CDC defines a high-risk individual as the following, and special accommodations should be made for these types of employees, and they are encouraged to work from home if possible. These would be individuals over the age of 65 or those with underlying medical conditions that include but are not limited to the following. It is likely this list will change as more is learned about at-risk populations, so employers should stay on top of any new CDC developments and make reasonable accommodations whenever possible. Now to look at disinfecting and cleaning procedures. Cleaning and disinfecting of premises should be conducted in compliance with CDC protocols on a weekly basis. You should clean and disinfect common areas. Those can be restrooms, cafeterias, or break rooms, and surfaces which are touched by multiple people, and that should be done frequently. Every 2 hours is recommended for high traffic areas. Workstations should be disinfected by employees upon entering the office and before leaving for the day with cleaning products that are provided by the tenant. Staffing and attendance guidelines. It is recommended that the maximum occupancy of an office should be 50%. If a multi-tenant building, the landlord should design a plan to allow for social distancing within common areas, and if needed, designate employees to monitor capacity limits and social distancing in shared building areas such as the lobby or the elevator. The landlord and the tenant should limit the occupancy of common areas and break rooms to allow for social distancing of 6 feet or greater. This means remove decommissioned furniture or stagger break times. This guideline is not intended to diminish employee break time requirements as provided by the law. If practical, use tele and video conferencing while at a desk. You should coordinate employee arrival and departure times to adjust for limited elevator capacity or the impact of public transit capacity. You should minimize the number of in-person meetings, and if there is an in-person meeting necessary, remember to limit it to 10 people and to allow for social distancing. And also to implement a process or tools to ensure employees are aware of available capacity before beginning their commutes. Also, stagger shift start and end times to minimize congregation of employees during changeovers. Now for external interactions. Before allowing external supplier or visitors to enter, or while requiring them to wait in a designated area, the tenant should ask whether external suppliers or visitors are currently exhibiting COVID-19 symptoms. If practical, the tenant should take external supplier or visitor temperatures using an infrared or thermal camera or touchless thermometer. If a multi-tenant building, the landlord is responsible for screening at a loading dock. And the tenant should keep a log of all external suppliers and any visitors who enter the office in case contact tracing becomes necessary. Suppliers and visitors should wear face coverings over their nose and mouth when entering premises. And you should also limit the contact between external suppliers and visitors and your employees. These are all of the sections that are recommended to be covered as part of the Restore Illinois Phase 3 Recovery Program. If you have any questions or need additional support, please contact the Department of Commerce and Economic Opportunity directly. They have a hotline at 1-800-252-2925, or you can email them, or simply go to their website under illinois.gov/business guidelines. There are also additional resources that are all linked from the DCEO webpage, and both employers and employees can utilize these resources if they require further information. That concludes the training program. We thank you for your attention. We ask and encourage you to be safe, and we do hope that you keep taking care of each other, and the ILCA will keep taking care of you.